I'm Julie Zenner along with Greg Grell, and here's what's coming up on a special edition of Almanac North.
The world is on edge as governments and health agencies try to slow down the spread of the pandemic COVID-19 virus.
State and regional health officials will tell us what's happening locally and how you can stay healthy.
We'll talk with an expert on global health politics on the role government can play in slowing down an epidemic.
And updates on the blood supply and more on this special edition of Almanac North. Hello and welcome to Almanac North. Thanks for watching. Almanac North producer Greg Grell is here filling in for Denny. And Greg, this has been a week unlike anything that we have seen before, at least in my memory.
Not in mine either. In all the years I've been in the news business, we've never had a week like this.
Yeah, it's just been crazy, and we have some important information to share with our viewers, so let's get started.
All right, thank you very much, Julie. Well, the world seems to be grinding to a halt as efforts to contain COVID-19, the coronavirus, have halted major events and brought the economy to its knees. In our region, the major extent of the impact has been felt in cancellations and some confusion, but so far, no cases of the disease in our immediate area. Well, joining us now with the latest information is Ellen Hill. She's the Northeast Region District Epidemiologist for the Minnesota Department of Health. And Amy Westbrook is the Public Health Division Director for St. Louis County. And I want to thank both of you for being here today. I know you've had extremely busy weeks. And Ellen, let's just start with you and give us the current update. It's Friday, March 13th in the afternoon. Where does the state stand right now?
So right now, the state stands at 14 cases. So far, all the cases are south of us, and no cases in counties that are neighboring sort of the 7-county Arrowhead region of northeastern Minnesota. The governor did have a press conference this afternoon at 1 o'clock where we announced our first round of community mitigation recommendations and guidelines for the state.
And what are some of those things that would fall into that first round?
So some of those first rounds, and I should also clarify too by saying that we're treating this, if you will, sort of as the dial on your volume dial on your stereo system. So we're trying to start out really taking into account where we're at with cases and transmission in the state. So far we have not identified a local in-state transmission. All of our cases so far have travel links either internationally or to other states in the country. But the first community mitigation measures we're recommending are really taking a close look at these larger gatherings, so 250 people or more in these gatherings, and really taking a hard look at do we really need to have these gatherings, and putting some guidelines out there for considering canceling some of those larger gatherings. And then looking at those gatherings that are less than 250 people and looking at the space these gatherings are going to be occurring. Is there enough space environmentally where people can maintain some distance from folks? What are the environmental controls within these facilities? And then looking also at gatherings of even like 10 or more, and with those gatherings, do you have a higher number of people who would be considered being in a high risk population for severe outcomes for getting an infection?
Amy, from the county standpoint, how well prepared do you feel like the county is if this epidemic does reach our area?
Well, we have been doing a lot of planning, especially that's true in the past years. We do have positions dedicated to public health emergency planning. So I feel like we're well prepared. The situation continues to change, so it's really hard to anticipate what will happen next. But we are working a lot with our community partners, making sure that there's open lines of communication with cities, towns, school districts, other important key stakeholders, and making sure that the information that's getting out is accurate and appropriate and timely. and making sure that we're a resource and that we're following the Minnesota Department of Health guidelines and CDC recommendations and taking our cues from the state primarily.
Mm-hmm. Now, in addition to the pandemic that's going on, we're also in the middle of what traditionally is our cold and flu season, where people kind of expect to get chills and fever and sniffles. And how does somebody know whether they're just experiencing the common cold and flu, or if they should be concerned and contact their health provider and get tested for the COVID-19?
So what we're recommending folks do is that if you're feeling at the point where, say this was the same time last year, are you feeling as say it was last year, if you're feeling this bad, would you have contacted your healthcare provider at that point in time for care? And if you would have done that, then we are recommending that you do contact your healthcare provider at that point in time. If you have been notified that you have a known exposure to someone who's been diagnosed with COVID-19, then and you're experiencing symptoms similar to influenza, then we would recommend that you definitely call your healthcare provider and mention your exposure history, and that you'd like to be tested if you would like to.
Amy, from the county standpoint, do you work with the local hospitals and clinics, and have you had some communication with them and how prepared they are for these situations?
Yeah, we have a really robust and active Northeast healthcare coalition where we bring together EMS, healthcare systems, and public health, sort of the spectrum of healthcare, and just making sure that there is a system in place to coordinate supplies and resources and communication across healthcare systems and across those groups of agencies. So we do feel, and we're also as a county working across departmentally with our partners in corrections and the sheriff's office. So we recognize, we're a service agency, we're a public health and human services agency, and we want to make sure that we're doing what we can to protect our clients and as well as the general public.
As you work with some of these community partners, are you getting a sense that there are enough kits available in our region for what could be the potential need? And if not, how do you prioritize who gets the test and who doesn't?
Yeah, that's a good question. Right now, the guidelines for testing are still meeting certain criteria. It's not a blanket, like anybody who goes in would be recommended to be tested. I would defer to Ellen about lab capacity and the number of tests that are getting out and getting back into the Department of Health lab. If she wants to take that question a little bit deeper.
Sure. So we don't have testing capacity immediately here in the region. The tests are being run right now at our state public health lab in Minnesota, and then there are also commercial labs that are coming online. One came on late last week, and then a couple others have come online this week as well. So clinicians can contact their laboratories within the facilities that they work in to figure out where the best lab would be to send specimens. But we are testing at our state public health lab here in Minnesota.
And Ellen, we've got a graphic that shows some of the steps people should take to kind of protect themselves as far as if you're feeling a little ill, what you can do. And I think we'll put that up while you're talking about, I think it's the cough and the wash graphic.
Right. Yeah, so we really recommend that people are washing their hands, and definitely after you use the restroom, of course, but also just other regular times during the day. If you haven't washed them for a while, it's been an hour or more, you might consider it. After you, of course, blow your nose or cough, that kind of thing. We would also recommend that folks cough into their elbow, not into their hands. It's a great way to sort of prevent those germs and some of the spray from a cough or a sneeze from going anywhere. And then also, it's stay home when you're sick. We can't emphasize that enough. It's very, very important to stay home when you're sick. And I know we try and tell people about this on a regular basis every flu season. We're all very busy people, and we have a lot that we need to get to during the day, but it's really important. And, the last thing I just would say is it's not too late to get your flu shot. We're still in influenza season.
One of the things that everybody is talking about right now is the runs that there have been in the stores on supplies like toilet paper, hand sanitizer, antibacterial wipes, things like that. Do either of your organizations have just some basic guidelines in terms of, maybe what people should be keeping on hand in their homes as kind of like a survival kit to get them through the worst of this, or to be prepared in case they would have to be quarantined for a while?
Sure. It is, this is a situation that not many of us, if any of us, have ever been in. So there is a certain level of high concern, I guess, with everyone. And I have heard there's been runs on toilet paper and that sort of thing. We do recommend that people have a good supply of medication in case they need to have that on hand and they're not able to get it. Food is a good thing to have on hand, extra food. Toilet paper is something that you should probably have on hand too.
But leave enough for everyone.
Yeah, don't stockpile too much. But those sort of essential resources that you need on a daily basis are important to make sure that you have not a stockpile, a small stockpile of those resources.
Ellen, we've just got a few minutes left, and I want to make sure we get to something that you and I talked about before the show earlier this week, and that is everything that we're doing to try to soften that bell curve of an epidemic. We have a graphic that goes with that as well, but that's the social distancing, the personal hygiene. Can you talk about that a little bit and how that can impact the extent of this epidemic?
Sure, yeah. So the bell curve that you're referring to, and what many people on social media have seen, is this idea of flattening the curve. And as you can see there, when there are no interventions, we have a really steep increase, a really very quick increase in the number of cases that are identified, the number of cases that are seeking medical attention. And whatever we can do personally and as a community to try and mitigate the spread of the disease really can help flatten out that bell curve. So your personal hygiene measures, washing your hands, covering your cough, staying home when you're sick, those are incredibly important. And then the community level interventions that we just started putting guidelines out for today, those are really important too, to also start help flattening out that curve and to really try and spread it out. What we really want to do is we don't want to, as much as we can prevent it, overwhelm the healthcare system. We want people to be able to seek, if they need healthcare, we want them to be able to see somebody and get the care they need, and that's incredibly important.
Amy, of course, the county has been in the nursing home business. What about older people who, are maybe more susceptible or more vulnerable to the impacts of the virus? Should people stay away from visiting their loved ones? What are the guidelines there? You hate to leave your mom and dad without a visit, but at the same time, is it doing more harm than good to go there to see them?
Right. It's a tricky balance. You want to show you care and be close to your aging parents or grandparents. But it is important to make sure that if you do go and visit, you're really taking a lot of precautions in interacting with people, that you're washing your hands, doing all the things and that Ellen mentioned, but limiting your visits if it's not necessary. I mean, that is a vulnerable population for this virus. So that population specifically, we want to be very careful when we're interacting with them.
All right, well, we are unfortunately out of time, but I really appreciate your sharing all this information. Ellen Hill, Amy Westbrook, and good luck going forward.
Thank you.
Thank you. during a national or international epidemic, we rely on information from reputable health groups. In the United States, that is the Centers for Disease Control, and internationally, it's the World Health Organization. But even these groups get bogged down by politics. Here to talk about the role of global politics during an epidemic is Dr. Jeremy Yude, Dean of UMD's College of Liberal Arts and a global health politics expert. And Doctor, thank you so much for coming in. We really appreciate it.
Thanks for the invitation.
Now, in your experience, have we ever faced anything like we're seeing right now with the COVID-19 pandemic?
Really, you have to go back to the 1918 flu epidemic that we saw at the tail end of World War I. We have seen other infectious disease outbreaks, obviously. We have SARS, we had pandemic influenza in 2009. We've had other sorts of diseases like this, but nothing quite to this scale and nothing that's moved so rapidly. Plus, it's something that we've not seen before. So that novelty makes it that much more difficult because we're also still trying to learn in the process of trying to figure out the policy responses.
Mm-hmm. And Dr. Yude, we didn't have time to put all your all your official criteria in our intro, your bio, so to speak, but talk a little bit about the organizations that you've been involved with and why you know so much about this.
Sure. My primary, a lot of my interest has been focused on the World Health Organization, how it works with different governments to try to affect a response to an international infectious disease outbreak. Because one of the things that we know is that no country is going to be able to control an outbreak like this on its own. Even if a country tries to close itself off completely, there's still the possibility of cases being introduced. And so trying to figure out how we're going to keep an eye on where cases are happening, make sure that we're sharing information, that we're sharing best practices and taking care of all of these sorts of steps that can be important, thinking about the policy responses, that's within the international system, that's the role of the World Health Organization. Now, they can't necessarily compel governments to do specific things. They can't force a government to say, you have to do X, Y, or Z, but they can provide best practices. They can provide that information. And in a time like this, it's so important to facilitate that sort of communication.
Mm-hmm. So as you've been watching this pandemic unfold, do you think that governments around the world are taking it seriously and are working well to coordinate what they're doing to contain things?
I think we've got a mixed bag so far. There was some criticism of the World Health Organization for delaying when it declared a public health emergency for COVID-19. And it's always hard to know in the midst of finding out all this information about a new disease whether the time is right. Should you be doing this sooner, later? It's hard to say, but the World Health Organization has been doing that. Governments themselves have been having kind of a mixed record. So we've seen examples all the way from the Chinese government, which essentially closed off major cities and tried to restrict travel and keep people in place. We've seen other countries that have taken very aggressive approaches to testing and trying to close down mass public gatherings, like we've seen in Singapore and South Korea. We've seen other governments that have looking at the Italian government, for instance, and essentially closing off the country and closing down tourism. And there's an economy and a government that really relies on tourism and lots of people coming in. And so that's having these sorts of effects. So we really do see a mixed bag. And I think after the fact, we're going to look back and try to learn the lessons and see if there are things we can apply going forward. But right now in the moment, everyone's trying to figure out the best step forward. And so we're going to see a lot of missteps.
Mm-hmm. Health and healthcare in general have become such a political hot potato in our country, mm-hmm. even under the best of circumstances. There's so much partisanship in the country right now, and there's in some corners a distrust of politicians, mm-hmm. a distrust of the media. How do you circumvent that and get people to pay attention to a global pandemic like this when people are wary of the information that they're receiving?
Absolutely. In these sorts of instances, the two things that are so key are communication and trust. Sharing the information, here's what we know, here's what we don't know, and how we're trying to find this information, and getting that information from reliable, trusted sources. And so the important things can be making sure that government officials are speaking with one voice, that they're sharing the same message, that you're not hearing different messages from different parts of the government, that this information is coming from people who have strong reputations. And we've seen a lot of that working out really well at the state and local level. I think both in Minnesota, Wisconsin, and really across the country, the state and local level has been working out really well. At the national level, I think we've seen more mixed messages, and that gets to exactly the point that you were talking about. People are unsure who they should trust. Should I be listening to the CDC? Should I be listening to what I'm hearing on this newspaper or from this TV station? Should I be trusting this random person that I'm finding on Twitter who's telling me that it's a biological weapon? There is that sort of confusion. So that's why speaking with one voice and having a clear, consistent message does become so important. And when you don't have that, you do introduce all of this ambiguity and all this uncertainty.
Beyond the messaging, do you think that the United States national government, federal government has taken some proper steps?
We're seeing some of the proper steps, but again, there have been sort of 2 steps forward, 1 step back in a lot of sort of instances. So even today we saw the national emergency being declared by the president. That's a good step because it does introduce additional funding available for state and local governments, and that will allow those agencies to be able to implement new programs, so that can be really effective. But on the flip side, it's taken us a long time. We've seen these mixed messages coming from the president, from other officials, and so that makes it hard to plan it, hard for agencies to know what should we be doing when we're trying to implement these policies in our local communities.
No, Dr. Yude, I mean, we're still in the middle of this. We're not quite sure how it's going to end up. But in the long run, do you think that maybe we're going to learn something, and maybe the next epidemic, maybe we're lucky that this one isn't quite as severe as far as death toll as some pandemics quite possibly could be?
That's the hope, that we can learn lessons and we can try to affect better responses in the future. If nothing else, I think this has really taught the importance of having strong public health systems and having pandemic preparedness plans ready to go, because we don't know what the next pandemic is going to be. We don't know what the next infectious disease outbreak will be or when it will happen, but we know we will have future ones. So the more that we can try to prepare ourselves and have those procedures ready to go if they need to be implemented, I think we will end up learning a lot from this. At least that's, fingers crossed, that's my hope.
The U.S. seems to be in pretty good shape in terms of healthcare expertise and infrastructure to get a handle on a widespread epidemic. Do you feel that there's the political appetite to provide the resources to kind of wrap around what we're seeing right now?
Well, it depends on what sort of resources we're talking about. So we have seen some resources allocated by Congress, and the president has signed that legislation. With this national emergency declaration, that also opens up additional resources. So that takes care of a lot of the healthcare resources. But we also have to recognize that if we're closing down schools or daycare centers, that has an effect on people. If we're closing down the ability of people to go to work, if we're telling them that they need to stay home, or we are telling people to shelter in place and not being able to go to, say, the grocery store. We need to have those other sorts of supportive services so that people can still continue to live their lives, they can get their medicines, they can do those sorts of things while still protecting themselves and protecting the rest of their community.
All right, Dr. Jeremy Yude, thank you so much for sharing some of your expertise with us. Appreciate you coming in today. Stay healthy.
You too. Thank you so much.
Thank you.
Organizations across the region have put policies in place to keep staff members and the public healthy during this pandemic. Many businesses and offices have publicized the steps they are taking to assure patrons can safely visit. Now, with many people limiting their exposure to others, blood donations are dropping off. But officials at Memorial Blood Centers say giving blood will not put you at risk for coronavirus.
It is perfectly safe to donate blood. All the staff are trained on universal precautions. We continuously wipe down surfaces. It's perfectly safe. The need for blood does not go away even during a time of pandemic. The blood need is still here, and so we're just encouraging everybody to keep your appointments to donate blood. Also, to keep your blood drives that you have scheduled, please keep them on the schedule unless you absolutely have to cancel them. And then also to basically self-check before you come and donate. We ask everybody to self-screen. If you're feeling unhealthy or unwell in any way, shape, or form, please let us know and don't come in to donate. One of the big impacts that we're going to be having is the cancellation and closing of the schools. And so with the schools and colleges starting to close and cancel together classes and just doing online classes, then some of our blood drives will be canceled as well. Between the schools and the organizations and businesses, that's more than 50% of the blood supply. We do actually have a pandemic flu preparedness plan. If it does get to be, more noticeable in our area, we do have additional plans to make sure that we can keep a blood supply for the community, and that does have additional precautions in it.
Memorial Blood Centers provides blood products to hospitals in Minnesota's Arrowhead region and in northwestern Wisconsin.
On Thursday, Wisconsin Governor Tony Evers declared a public health emergency in the state due to the COVID-19 epidemic. So far in the Badger State, there have been 9 confirmed coronavirus cases. All of the cases at this point have been in the southern parts of Wisconsin. Well, as part of our effort to keep you informed about the epidemic, WDSE is adding 2 additional Doctors on Call broadcasts. You can watch next Thursday, March 19th at 7 p.m. to have your coronavirus questions answered by a panel of medical professionals. Another Doctors on Call special broadcast will be on Thursday, March 26th at 7 p.m.
And if you want to review what you've learned on our show today, download the free PBS video app where you can find this and other Almanac North programs. You can also watch this show on our website, wdsc.org.
And Greg, it will be an interesting week to see what develops even 1 week from today.
Yeah, and I don't think anybody knows what's going to happen, but let's hope that everybody stays healthy.
All right. Well, for Greg and the entire crew here at Almanac North, I'm Julie Zenner. Stay healthy, and we'll see you next week.